Good day, everyone. Our topic is comprehensive health history taking. A good health history is said to be the core in diagnosis and treatment of patients. Comprehensive health history is defined as the complete fundamental knowledge of the patient. This involves two approaches. In patient-centered approach, the patient is free to express himself, while in clinician-centered, guided questions are directly asked. History taking starts from the patient-centered approach, going towards the clinician-centered approach to extract the patient's biopsychosocial story. Why are we taking health history? Establish rapport to your patient to gather information for diagnosis and treatment and to develop proficiency and skills. Here are the must-dos during history taking. First, always introduce yourself, your role and purpose. Ask for patient's name. Secure the consent for the interview. Observe confidentiality at all times. Lastly, be empathetic and practice active listening.
Now let's review the components of comprehensive health history. First, identifying your data, the type, the source and the reliability of your data. Second is chief complaint. It is the main reason that the patient had a visit. If possible, quote the patient's own words. Third, history of present illness. This is a complete chronological account of chief complaint. Every symptom should be well characterized based on the 7 attributes. Contribute to the risk factors and medications taken are also asked. Fourth is the past medical history. It contains childhood illnesses, adulthood illnesses, and maintenance medications, health maintenance practices like vaccinations or screening tests, and certain allergies that the patient might have. For female patients, the OB/GYN history is also taken. This contains the last menstrual period, the OB score, the date of menarche, and others. 6 is the family history. It documents the health status of the family. Common hereditary familial diseases like hypertension, diabetes are asked. Another way to obtain data is using a genogram. It is a graphical representation that looks up the health details of the family.
7 is the personal and social history. This involves the recreational and occupational practices of the patient that are clinically significant. It includes important life experiences, current situation, lifestyle habits, especially diet, smoking, alcohol drinking, and drug abuse. Last is the review of systems. This is to document the absence or presence of common symptoms for each major body system. This helps the patient remember forgotten data. Pertinent data should be included in the history of present illness. Start asking about the general state of the patient, like weight changes, then go to specific major body system symptoms. And now let's take a look of the simple comprehensive health history taking.
I am JC Laking. I am a third-year medical student. I was tasked to have this conversation with you today. Let's go through your details, sir. Can you tell me your name and age?
Yes, I'm Marianne Oribelio, 34 years old.
Okay. So, Marian, what prompted your visit today?
Yes, I had this chest pain this afternoon while I was cooking at home.
Was this your first time to experience this kind of pain?
Actually, no, because I've experienced this years ago.
Okay. Can you tell me exactly where the pain is?
It started here at the middle of my chest.
Okay. So, how did it start and how long did the pain last?
Uh, it was sudden. And it's kind of moved to my arms and neck. for about 20 minutes.
Is there anything else aside from the pain?
Yeah, actually, I had trouble breathing uh, in between the pain. In 2009, I also had this chest pain, as I was saying, um, with palpitations, and my BP was elevated as well. So I was advised to have that to the echo, and they said I have this mild mitral valve prolapse.
Were you prescribed medications for that diagnosis?
Yes, I think it was propranolol for my palpitations. But luckily, I did not take it for long.
Do you remember having any illnesses when you were a child?
Not really that serious. I just remember being hospitalized due to cough and colds. Yes, I was hospitalized in 2014 when I delivered my son via cesarean section.
So have you had any vaccinations or screening tests?
For the screening, I had pap smear in 2019. At the same time, I completed a dose for the HPV.
Okay. So may I also ask when was your last menstrual period, or was it a regular cycle?
Yeah, my cycle is regular, and I menstruated April 25.
Are there any members of the family that suffers from hypertension?
Yeah, most of them.
How about stroke or diabetes?
Stroke. My two grandfathers died due to stroke. For the diabetes, my father was diagnosed for type 2 diabetes mellitus, and is under medication.
How about asthma or lung diseases or in certain cancers?
Asthma, my son had this asthma when he was young.
Do you smoke or drink alcohol?
I don't smoke. I drink alcohol sometimes. Yeah.
Do you exercise?
I exercise. I actually do things inside the house. So I think that's already exercise.
How
Doing
about
household
your
chores.
diet and
Diet.
your leisure activities?
Diet. I eat everything.
The leisure. Or you have to ask if you have any of these any headache. Do you experience headache, vertigo?
Yes,
Dizziness?
for the headache, I experience headache once in a while. I'm okay with my eyeglasses.
And how about your any problems in the?
None so far.
So you mentioned earlier that you've had difficulty in breathing. Do you experience this often, or
No, just a while ago when I had that chest pain.
how about a cough or
Cough,
case of asthma?
yes, cough. I occasionally have cough, but not all the time.
Okay.
Okay, Miss Marian, that is all for my interview. Thank you for your time.